What are floaters?
So floaters are a very common symptom, and those are usually caused by something opaque inside your eye. And the most common reason for that is that as we get older, the vitreous jelly changes in composition. When we're young, the jelly is a solid gelatinous mass and doesn't block any light. Once we get a little bit older, you get little water vacuoles that form within the vitreous, and then some of those proteins start to precipitate. The proteins become solid rather than being liquid, and they're no longer dissolved in the vitreous jelly. When those proteins start to precipitate, they block little bits of light. People notice floaters more when it's a white or similar background, and they have bright light conditions. So the classic example would be skiing or looking at snow. You'll notice your floaters more. If you're sitting in a dark room or a dim room with a big pupil, you won't notice the floaters as much or at all. And so floaters can be different things. They can be the vitreous jelly inside your eye, they can be pigment, or they can be blood. Most floaters are benign and not a problem for you to seek medical attention, but floaters that are new and numerous, those are floaters that you should be looked at for. And so the idea would be to see an eye doctor at that point and get a dilated exam where they look at the side part of your retina. Think of the eye as a camera, and the floater as being some sort of dust or precipitate right in the middle, and it's casting a shadow on the retina. And that's why people perceive that darker area as a floater.
What is a vitreous detachment?
So a vitreous detachment is a separation of the vitreous jelly from the back part of the eye, where your optic nerve and your central macula are. The vitreous is very adherent in a circle around the side. And so what happens is, because the retina doesn't have any pain sensors, it only has light sensors, when the gel starts to pull on the side, you perceive a flash of light that's not there. And then when these bits of vitreous jelly start to move around in front of your center vision, you start to see these opaque shadows forming. So that's a vitreous detachment. And so for most people that get a vitreous detachment around the age of 50 or 60, the vitreous just separates and you see a few more floaters than you did historically. And so most of the time it's not a serious problem. And so it's very common. 50% of 50-year-olds will get a vitreous detachment, and most people don't need any treatment for it. That being said, this is the time in your life when you're at risk of getting a tear in your retina, because as that vitreous separates, if there's a little area that's adhesive, it can tug, especially on a blood vessel, and rip your retina. And those rips are what can cause a retinal detachment. Now, retinal detachment is much less common than this, and the incidence would be about 1 in 10,000 people per year. So much more common to get a vitreous detachment than a retinal detachment. But it is important when you get a vitreous detachment to be examined to make sure you don't have a small tear that can be easily treated. It's much easier to treat a tear in your retina than it is to treat a retinal detachment. And the consequences for you as a patient are much better if you just have a little bit of laser work rather than waiting for your retina to detach. So vitreous detachment is an age-related condition where about 50% of 50-year-olds will get one. And for most of these patients, it's a benign condition that causes some floaters that are certainly irritating, but they're not generally dangerous for your vision. And so most people with vitreous detachment don't need any treatment for it.